Okay, so here we go with Subfertility EMQ practice session, and we are going to do 10 questions in a row, and this is going to be a totally interactive session. I need volunteers from you because you are going to solve the question and then we are going to discuss about it, right? So anybody who wants to do can raise the hand. The person who raises the hand first will get the opportunity. So one by one, we will be doing 10 questions in a row. Right. So Dr. Wasavi, very good. And this is your, okay. Wait. 3 questions. One, Dr. Wasavi, then Dr. Manisha and Dr. Surya. 3 are done. And after that, I'll ask again. Okay. So just wait till then. Okay. So let me start. First one. Yes, Dr. Wasavi, you are going to read the question and you are going to answer it and you are going to give me the explanation why this answer is, why you think this is the answer.
Good evening, ma'am.
Yeah, good evening. Yes.
A 34-year-old woman and her 25-year-old partner have attended the fertility clinic because they have not conceived a pregnancy after 6 months of monthly insemination with donor sperm. The couple are in same-sex relationship, and 34-year-old woman who is trying to conceive has a BMI of 29, a regular 28 cycle with no symptoms of pelvic disease. Semen analysis of a donor is normal. FSH level of day 2 to 5 of cycle is also normal. Serum anti-Mullerian hormone is 20. And day 21 progesterone is 42. Hysterosalpingography confirms patent fallopian tubes.
Yes. What is the most appropriate management for this patient?
Yes, ma'am.
Rest everybody can answer in the chat box.
Okay, ma'am, continue donor insemination because the female, there is no problem because she's 34 and 29 BMI is, it's acceptable BMI, and 28 cycle, there is no disease of pelvic disease. FSH is normal over here. Anti-Mullerian hormone is normal. Day 21 progesterone, she's ovulating because it's 42, and bilateral tubes are normal over here, and they are in same-sex relationship. At least we can try for 12 cycles of donor insemination, right, ma'am?
Okay. Okay.
So already 6 months of monthly insemination is over here with donor sperm. So other 6 months we can try, ma'am.
Okay.
So K would be the good option, ma'am, over here.
Okay. Okay. So your answer is K, right?
Yes, ma'am.
Okay. So now in chat box, I see answers as B and L, right? So would you like to give any explanation, those who are answering B and L? Rest all are, I think, predominantly K. So K explanation we have got. What about L and B? Yes, you can unmute and speak up. Those who want to give explanation for L and B. Dr. Maya, this is explanation for which option? 50% will conceive in 6 months. Okay, for K we have got the thing, that is we have tried 6 months and we can try for 12 months. So we'll go ahead with 6 months. So K option already explained. Now B and L. I want explanations for these options. L, I think 3-4 students have answered. So any
Ma'am,
of you can give an explanation. Yes.
ma'am, already 6 cycles of IUI have taken place, so the next option would be IVF treatment.
IVF. Yeah.
Okay. 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 So as like you think that 6 is done, so we have to shift to IVF. Okay. And what about B? I think somebody answered B as well.
If
The
BMI
next,
is more than 30 kgs per meter square, then we can try for a weight loss, right, ma'am, over here. But she's 29 and she's ovulating also. So there is not to consider as a weight loss as a first initiative step to her.
Even if the BMI is 31, then what? Would it affect
Uh,
your answer?
If she's not ovulating, then above 30, we have to advise her to weight loss. So that her ovulatory cycles will increase. But already she's ovulating, even though we advise her to give a weight loss to her. Why? Because above 30, there is a negative impact on fertility.
Right. So basically, BMI will not make a difference here. Why? Because we are not stimulating. If we had to stimulate a woman, then we will not stimulate her at BMI 30 or above. But in this case, it is a non-stimulating cycle. And secondly, they are same-sex couples. So we are doing donor insemination. So nothing related to like infertility treatment. It is like you are doing I mean, if you can take it as a natural cycle also, because you are just giving her the semen, right? So therefore BMI will not make a difference here. Now coming to what is the scenario. So your explanation is absolutely correct, that everything is fine. Her hormone levels are fine, she is ovulating as well. So total we can try for 12 cycles, right? After 6 cycles, we might need to reassess the patient and see that whether she is still ovulating and tubes are patent, and then we can go ahead. So total 12 cycles can be done. Now, if you see that there are two options, C and K, right? So C is intrauterine insemination for 6 cycles and continue donor insemination for 6 months. Does it make a difference?
yes,
What difference?
maybe a different partners, a different person's sperm donation could actually be used in intrauterine seminal insemination in IUI.
Okay. Okay. So basically, any other thing you want to mention about the difference in C and K? If you have to
Ma'am, one
choose
thing,
between C and K, which one you think is a better option?
ma'am, C will be better. Good evening, ma'am.
Yeah.
Because 6 cycles, when they are saying 6 cycles, that means they are more concerned about 6 ovulatory cycles. But in months, she may not ovulate. Maybe it's just
Yes.
they are writing it's months. So, they are not very sure. Maybe in cycles, it is like she is ovulating and then you are doing IUI for her. 6 ovulatory cycles. In continued donor insemination for 6 months, she may ovulate, she may not ovulate. And just for 6 months, we are giving donor insemination. I think that can be the difference, ma'am.
Yeah, absolutely correct. 6 cycles is a better way to answer the question, because see how the EMQs are. You can have 2 or 3 very close options. We all know that we can give 12 cycles. 6 already done, so 6 more can be done. Now, if you look carefully, 2 of the options say that we can give 6 cycles. Rest all are completely not in a favor of our question. We know that we are going to do unstimulated. So any option with clomiphene, letrozole, these all are gone. Now we come to the IVF. So IVF is not indicated prior to 12 cycles, right? So IVF options are also gone. Weight loss right now at 29 does not have a significance. Even if this is 31 and she is ovulating, then also this is not the basic factor which is affecting. So largely you remain with two options, C and K. So as Dr. Chavi mentioned very nicely that there is a difference between 6 cycles and 6 months, right? We are talking about 6 ovulatory cycles when we are going to do insemination, which may not be equal to 6 months, may or may not, right? So in that terms, 6 cycles is a better option than going for 6 months. So this small difference makes C as a correct answer rather than K.
But
Fine.
see, ma'am, there is
Yes.
no donor cycles, right, ma'am, which was not mentioned in C. IUI cycles, the partner, like they have already mentioned it is a same sex relationship, and already they have mentioned 6 months of monthly insemination with donor sperm. But exact wordings will be the K will be the better option, right, ma'am, than C, because donor insemination they have written. So that is the tricky one, but
This is from NICE. This is from NICE. Okay. So if we look at the language, let me just read it for everyone. So consider unstimulated intrauterine insemination as a treatment option in following groups as an alternative to vaginal sexual intercourse for people in same-sex relationships. For who have not conceived after 6 cycles or donor or partner insemination, despite evidence of normal ovulation, they can go for 6 cycles of unstimulated intrauterine insemination. So the word being used is still the intrauterine insemination. And here, if you see in the question also, it is insemination with donor sperm. Right? So word intrauterine insemination does not rule out donor insemination. It includes both the things, donor and partner. So we are not like ruling out that we are not doing intrauterine insemination. If I am saying, that does not totally mean that I am talking about the partner only. It can be true for donor as well as partner, right? So therefore, this is a more broader term which can include both the things. And as I have read it already, the guideline also mentions the same word. If this is not in the option, if C is not in option, then K is certainly a good option, right? If C is not in option, then your next best option will be K. But here, right now, this word cycles and months make it different, right?
yes, ma'am. Yes, ma'am. Got it.
Okay.
Yes, ma'am.
Everyone, okay? Right? So it is clearly mentioned in the guideline. Clearly, it is from the NICE guideline. Okay. So this is how your questions are asked in exam. And you basically have to remember the guideline and try to pick up answers from the guideline itself. Right? Again and again, I'm telling you, don't make your own concepts. Just fix the points of guideline into your mind. If you are creating your own concepts, we can maybe do this, we can maybe do that, then it is not going to help in exam. It's going to totally confuse you, right? So please fix your points from the guideline itself. Okay, and these small differences actually make EMQ tricky. So we have to catch hold of these small points here, right? Everyone okay? Anybody has any confusion? Fine. So next question, Dr. Manisha.
34-year-old woman with her 35-year-old partner has been referred to the infertility clinic because of 2 years of primary infertility. The woman has a regular and normal 28-day cycle. Her BMI is 26 and she has no other symptoms. Investigations have shown normal LH, FSH, thyroid test, prolactin and day 1 progesterone concentration confirms ovulatory cycles. Her partner's semen analysis is normal. Choose single most option, important initial management option.
IVF.
A, in vitro fertilization.
Okay, I need explanation.
Ma'am, since they have mentioned that she has a infertility of 2 years, but then one thing in A, that they have not mentioned anything about the tubal patency. But since 2 years they have been taking, they are trying it. I am assuming that they have tested for the tubal patency as well. So after 2 years, if they are not conceiving with normal reports, then IVF is the next plan of action.
Okay. So you want to go with A,
A.
right? Okay. So your answer is A. Now, what answers I can see in the chat box are A, C, and I. So A explanation is, I think, already there, and yes, here also in chat box, unexplained infertility for 2 years, right? Any other explanations for A and those who have answered I and C?
And we can't label unexplained until we have all the basic tests, including tubal test. So tubal test is not mentioned here. So once we have that, we can label it as unexplained and then proceed with IVF or salpingectomy and IVF.
Okay. 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 That's okay. So your
think
answer
I,
is
I think all
HS.
the
Yes.
but
Yeah.
I think I presume that HSG must have been done because they said virtually all the parameters are actually normal. So 2 years of unexplained infertility, IVF, I think it should be
No,
the
but
better
we
option.
can't assume, right? Because they have not mentioned something on purpose.
And other more important point,
They
ma'am,
say
whenever
investigation have shown normal. Okay. Thyroid function test and this and that.
Okay, yeah. Dr. Hassan, I understand what you say. Yes, somebody else was also saying.
we can't label her as unexplained, right, ma'am? Because she's having a pathology of PCOD. Sorry, the tubal function test, which was not mentioned over here, and her BMI is normal. Her all functions were also normal. Her male partner semen analysis were normal. So tubal function is missing over here. Over here, so we have to rule it out the tubal function. Then we can label her as an unexplained, right, ma'am? In this case, because already 2 years, we should know all the parameters to label her as a unexplained.
Okay, got it. Anybody else?
Okay. They
C
said
answer also
initial
I saw in the
monogamy.
chat box. Yeah.
They said initial, so I think HSG should actually be the initial. I think
You
so.
don't get two chances to answer questions, right?
Is when I just went through and I saw that initial, because the question
Okay.
initial,
So
the
anybody
initial,
like to talk about C option? Because that was also in the chat box.
but there are no comorbidities, so lap and die shouldn't be the first, if I'm not mistaken,
Okay.
because in one of the presentation, if there are comorbidities like endometriosis and others, you go for lap and die.
Okay, great.
Before going for IVF, we can also try lap and eye test to confirm once before undertaking any fertility treatment.
Okay.
Again, another valid point, ma'am. If there is any previous history of pelvic pathology, ectopic pregnancies, and all these things,
Then
we
lap
can go
and die.
up. If she is
Okay.
not having any previous history of all these things, PID, ectopic pregnancy, or all these
Yes.
things, then we can go for a
For
hysterosalpingogram.
HSG,
Right.
yes,
Okay.
yes.
Dr. Manisha, would you like to change your answer?
I'm just confused why, if they've written 2 years of primary infertility, then why the investigation was, I mean, I'm just assuming that that test was done in 2 years.
Okay. Okay. So let's talk about it. Right. So basically, this is 2 years of unexplained 2 years of primary infertility, right? And when do we say that it is unexplained infertility? It is not just by 2 years. Unexplained infertility is not just by 2 years. The basic concept is that all investigations should be normal. It is not just 2 years which make it unexplained infertility. 2 years is important because we will wait for 2 years and then we will go on to IVF, right? But 2 years is not the only word which makes the definition of unexplained infertility. We need to have all the female and the male these investigations normal. So we know that what are the basic investigations: ovulation test, tube test, and semen analysis, right? These are the 3 basic things we need to see. So out of these, they say that ovulatory, they say that semen analysis is normal, but they didn't talk about the tube. So we cannot actually presume it that the tube test has been done. How can we presume if it is not written in the question? So right now, to make it unexplained infertility, one test is missing. That is tubal patency test. When that is also mentioned that tubal patency is tubes are patent, then you can label it as unexplained infertility, and then you go and see the time duration. If it is 2 years, choose IVF, right? But in this case, nothing mentioned about the tubal test. So first we have to do the tubal test. Now for tubal test, we have 2 options, I and C. So there was confusion between these 2 as well. But here, as rightly said, there is no comorbidities. Everything is fine. This patient does not have any risk factors for the tubal blockage or the tubal damage. So basically, HSG is the basic test which we have to do in this patient.
Okay, ma'am.
Right? So basically, tubal patency needs to be assessed, and in the absence of symptoms suggestive of pelvic pathology, HSG should be undertaken. Does it make sense to everyone? Any confusion?
Yes, ma'am.
Fine. Okay, great. So these small things we have to see. Specifically, we are discussing EMQs because you know the concepts. You all know the concepts because these small things make difference in the answers. Okay. So now you will take care of these small issues while answering your EMQs.